Level 989.
Welcome to episode 6 of 989 on Health, the show where you don't need years at university to understand the latest news about health and related subjects.
An important announcement for our listeners. This podcast is intended to be an informal tool for laymen and practitioners alike to hear our viewpoints on health and wellness. Don't rely on the information in this podcast as an alternative to medical advice from your doctor or other professional healthcare provider. For the full disclaimer, please see our website.
I'm Mike Davalos, just a guy, an average Joe. If I opened a book, there'd better be pictures. And I'm joined by the opposite of average, Brandon Weintraub, a primary care physician. Good morning, Brandon.
Good morning, Mike.
So we're many episodes in at this point, but I remember back when we were preparing for our first episode, I asked you if we could do just a single episode, what would you want it to be about? And you answered right away, diabetes. Why is that?
Honestly, there are a whole slew of reasons. In my experience, diabetes is incredibly misunderstood. My patients have been given insulin or a drug or possibly a set of drugs by their physician and been told to keep an eye on their blood sugar, and that's it. There's very rarely an explanation of what diabetes is or why they're taking any of their prescriptions, just a general folk knowledge about what's happening, and a lot of that's been gleaned from what friends or relatives have told them. What makes this upsetting to me is that diabetes is a disease that the patient has a really significant ability to control, and they can really help reduce its impact on their health.
I think before we go any further, we have to define exactly what diabetes is. People think they know, and maybe you could explain just in simple basic terms what it actually is, and maybe what it means long term.
Okay. Diabetes is a disease. People use a lot of terms to describe diseases. We want to think of it as a symptom or a collection of symptoms that are from a common cause. Things like acid reflux, that's a disease. It's not caused by a virus or bacterium, but it's a physical symptom resulting from a malfunction of normal bodily processes. Diabetes as a disease is a failure to process sugar in the correct way. There are basically two types of diabetes, type 1 and type 2. And oftentimes people look at type 1 as the worse, scarier version, and type 2 as more or less mini diabetes, something that's not quite as frightening. But both varieties of diabetes are really serious. Type 1 diabetes results from a lack of production of insulin. Insulin is the chemical that allows your body to regulate how much sugar is in your bloodstream. So if your body can't produce enough insulin, or any insulin at all, you essentially have no ability to metabolize and control your own blood sugar. With type 2 diabetes, your body does produce insulin, and it can self-regulate to a degree. But for whatever reason, it's not sensitive enough to that insulin. The end result is the same. You have excess blood sugar in your bloodstream. Both are equally dangerous.
So if I'm understanding you, it sounds like it's all about blood sugar, and either your body can't process it, or your body is releasing the chemicals to process sugar, but those chemicals aren't working like they should. And another thing I learned during my research is that basically everything you eat, a steak or a cookie, in the end, in your body, it's broken down into sugar.
And that's exactly right. The primary source of energy for your body is basically sugar. So whether you're eating that steak or you're consuming a loaf of bread, whatever the case may be, the end result is always broken down into basic sugars that your body can utilize to create chemical energy.
So what causes diabetes?
That's a really tough question. In the pancreas, there's a type of cell. It's called beta cells. Those are the cells that produce insulin. With type 1 diabetes, what happens is the body's immune system attacks the portion of the pancreas that's responsible for making insulin, and that's what leads to your blood sugar regulation issues. In type 2 diabetes, you've got your beta cells, and they're functional, but the other cells in your body have become resistant to insulin. The beta cells work fine, but the insulin generated isn't enough to adjust your blood sugar levels. What creates that lack of reactivity of the cells to the insulin is still up for debate, and there's multiple possible factors.
It's not just, oh, my pancreas isn't making enough insulin, so I need to have a shot every day, and then I'll just continue to live my life normally. It seems to be something that affects your entire body and really should affect your entire way of life.
Absolutely. Your entire body requires the right amount of sugar, the right amount of energy at all times. Without adequate regulation, the excess sugar in your bloodstream can damage more or less every organ in your body.
So basically, it's killing you.
Diabetes is definitely a deadly illness if it's not controlled. It goes far beyond the my blood sugar isn't right. The host of consequences resulting from diabetes are so widespread and so significant that, without question, unchecked or uncontrolled diabetes will be detrimental to your health. The fact is that in 2014, diabetes was considered the number 7 cause of death in the U.S.
It sounds weird to say, but I don't think death is a good deterrent. Telling people it's something that's going to kill them isn't as scary as telling them the other effects of diabetes. You're a lot more likely to get infections. You're a lot more likely to lose your toes, your feet, your legs, your hands. I mean, to read some of the long-term impacts of the disease, they're lopping body parts off you like you've got leprosy or something.
Telling someone that a disease will kill them, especially if they're feeling pretty well overall, it's not going to deter them from continuing to live their lives the way they have. At the same time, we don't want to use scare tactics. The goal isn't to frighten a person into controlling their diabetes. The goal is to give them the information they need to feel comfortable understanding why they need to change their lives. So, telling someone that they're going to die as a result of a disease is a far away, hard to understand consequence, and it's difficult for most people to relate to. What we see with diabetes is a horror story about loss of toes or feet or legs or blindness. The fact that these symptoms can be so well controlled by a patient's own decisions is one of the things that makes discussing these symptoms so important.
So how much to blame is just modern food culture or the average level of fitness when it comes down to what a big problem this is?
Beyond a shadow of a doubt, exercise plays a significant role, especially for type 2 diabetics. The level of exercise, how much activity they have, what they eat, and how much they eat of it makes a huge difference in controlling diabetes. With prediabetes, you can eat healthily and increase your activity and cut down your risk of actually getting type 2 diabetes by about 50%. That means you lose weight, you get healthier, you eat the right things, and you've halved your chances of getting full-blown diabetes. And you've reduced your likelihood of all of the illnesses that come along with diabetes. Heart disease, stroke, blindness, loss of limbs. And that's just by changing what you eat and how active you are. A recent study in the UK showed that people who were trying to control their type 2 diabetes over an 8-year period got equal results whether they were taking medications or doing exercise and diet control. So, as I mentioned at the beginning, diabetes is one of the illnesses that a patient has incredible control over. By changing their diet and changing their level of activity, they can have just as much an effect on the disease as if they were taking a pharmaceutical.
So, should we all be getting our blood sugar tested? I mean, ideally you'd go for a professional blood test, but I think most of us know a friend or a family member who has diabetes, which I guess just goes to show how common it really is. But you could ask them, hey, can I have a test strip? Can I test my levels with your blood sugar meter? Just to get some idea of where your blood sugar is. And maybe in some cases you might say, wow, it is a little high. And then go to your doctor and get checked out by a professional.
My advice is a little bit mixed for that. It's easy to become overreactive to numbers and tests that you don't fully understand. While there are baselines out there that will tell you one way or the other if your blood sugar is high or low, doing a blood sugar test at the wrong time can give you extraneous results. What I would suggest is if you have concerns about your blood sugar levels, go see your physician. They're going to have an idea of how to perform the tests under the right conditions to make sure you get the results you really need.
I think one of the big problems with getting people tested is the fact that blood is required. So they're going to cut you, there's going to be a sharp prick, and you're going to bleed. First of all, a lot of people don't even want to think about getting their skin cut. When the day comes that I can just press my iPhone to my wrist and it tells me my blood sugar, that's going to make it all a lot more approachable for millions of people. I know there's a lot of new and different sensors that are in development, and that's good because the bloodletting part is one of the big barriers for most people.
And you're absolutely right. Anytime you have to experience discomfort, and especially anytime a needle's involved, that's frightening for people. But understanding how much this disease can affect you, the ordinary 4 blood tests a day that a diabetic needs to make sure that their blood sugar is properly under control, if you compare that to the endless series of tests and hospitalizations and potential amputations that you might see, that little pinprick you've got to do a few times a day becomes pretty insignificant, and it's really not overly uncomfortable. It's that brief little prick and you're done. And it's difficult to adapt to, but it's better to do that than to have to worry about losing arms and legs.
When someone you know tells you they were just diagnosed with diabetes, you just think they're going to need to cut back on the cake and cookies. Maybe they'll need daily injection of insulin, but their life's going to be pretty much the same otherwise. But one of the details they didn't know is how much it impacts your blood vessels. And as a result, that can cause kidney damage, heart damage, blindness. So if your friend told you they might go blind soon or need dialysis, you'd probably have a much stronger reaction.
Again, our goal isn't to frighten people. What we're trying to do here is to inform them so that they have the right tools to make the right decision for themselves. Especially with a disease like diabetes, a little knowledge can go a long way. Changing the outcome of diabetes is so strongly in the hands of patients themselves. So there are all sorts of statistics I could quote, but what's really important is the basics. Excess sugar in the bloodstream can damage capillaries, you're right. That impairs biological waste filtration. It reduces the body's ability to heal from injury. Any organ or part of the body that requires correct blood flow is at risk. So a diabetes patient has to worry about cardiovascular disease, nerve and kidney damage, eye problems, poor healing, reduced hearing, skin conditions. Even the risk of Alzheimer's disease may be increased in patients with type 2 diabetes. And for all the advances medical science has made, one of the best things a patient can do to reduce their risks of everything we've listed above is basically just to exercise and eat with their condition in mind.
People think they know what diabetes is. It almost seems like it's time for a rebranding. Maybe it should be called organ failure or something else that kind of gives the impact of what it's going to do to you. I'm sorry, sir, but you have early onset organ failure. And that would make people say, I have what? How do I get away from this? Now, the next point covers most illnesses that come from bad behaviors, but if you told someone they had cancer and then they ask what they should do, and you say, oh, all you have to do is change your diet and the cancer will go away. They would change their diet. But in the developed world, our food culture is in a bad place. If you need fast, cheap food, you probably end up with something that's terrible for you that can lead directly to diabetes. So I think probably over the next 20 years or so, hopefully our food culture will go in a better direction. It can start with small things. It was kind of silly recently. Well, it was probably a few years ago, actually. You couldn't sell a large Coke in New York anymore. Just something like that, a bit of portion control. It's a start. It can help. There's definitely something to be said for, you shouldn't be able to have 1,000 calories in one small candy bar or one small sandwich or one small beverage.
I'd like to think that a rebranding isn't necessary. The major problem is that most Americans have the too long didn't read information on diabetes. They know its effects, and they know that it makes them sleepy, and maybe it'll make them sick eventually, but that's about it. Their understanding of its treatment is woefully lacking. I have to take this pill or take this shot 3 times a day, and then I'm fine. And they don't really understand how this is helping to control their diabetes. If every patient who came in and was diagnosed with diabetes or prediabetes were told not just that they had the disease, but were given an in-depth understanding of what it was, what it meant, and what had to be done to fix it, I don't know that a rebranding would be necessary. I happen to really like your example about cancer. It's awful to say, but it's a good way to look at almost any illness. Cancer is considered to be more or less the end-all be-all of diseases. Just the word cancer invokes fear and discomfort and a sense of mortality. Whenever you're talking about a disease you don't want to get, cancer's right at the top of the list. Why is that? It's because the treatments are so unpleasant and the side effects are so immediately obvious that even the average Joe who hasn't had cancer has that visceral response. With something like diabetes, where the treatment is more or less, give me a shot and I'm fine now, pass the spaghetti. People don't have that same sense of immediacy. They don't have that sense of their own mortality as a result. If you were to tell someone with cancer that, you know what, all you have to do is stop eating carbohydrates, change the way you eat, and exercise more, I would venture to say that most cancer victims wouldn't hesitate. My change in diet is going to help reduce my cancer would be an easy decision, and it would be easy to stick to.
If the doctor's office told you, okay, we're going to set you up with the insulin injections, we're going to set you up with your home dialysis machine, your seeing eye dog, you should start practicing with him now because you're going to need him soon. We're going to sign you up for that helper monkey because when you lose a few fingers...
And I would hate for our listeners to hear us talk about this disease and think we're being flippant. But there's some truth in what you just said. If people really understood the stakes in controlling their diabetes and how much of a difference they themselves could actually make, I think we'd see a lot of healthier people out there. Even when pharmaceuticals are introduced to help with overall blood sugar control, the patient still has a lot they can do to further their treatment along.
I think we've made a lot of the risks pretty clear. Maybe the point we still need to make is, okay, you've convinced me. What do I do now?
It's very easy to say, you need to make changes to your diet and to your exercise regimen. They're great statements, but how does a patient go from that to making an actual useful change? We're going to have to deal with generalities. There's no illness out there that can be treated in every individual in exactly the same way. So here's one of the generalities I would make. Your diet is key. What you eat is going to directly relate to how much additional sugar is being taken into your body and makes its way into your blood. That's not to say eating is the only factor that matters. Your liver can create sugars if it's under the impression that you don't have the right amount. So your sugar levels may still go up even if you're eating a very low sugar diet. So what do? When you're changing your diet, you have to look at what you're eating and try to make sure that the content, sugar, carbohydrates, fiber, are all balanced with your condition in mind. Talk to your physician, Western or Eastern. They're going to be able to give you more specific information that's tailored to you.
But you know, I'm busy, I got a wife, I got kids, they're picky, they're demanding eaters, I got a job, I'm taking night classes, I'm exhausted, Brandon, I ain't got time.
And those are perfectly valid arguments, but if you're going to make changes, you've got to recognize what's realistic for you, and you can then start working towards those goals. If you haven't had a chance yet, I strongly suggest you listen to our previous episode on food. There are big changes we can discuss that will help almost every diabetic. Breads and pastas are possibly the biggest downfalls for people who are trying to control their diabetes. Carbohydrates get converted straight into sugar, and since most people would find it impossible to stop eating these foods right away, switching to a whole grain variety is going to be a step in the right direction.
So if you just said that carbohydrates are a huge downfall, why would switching to something with whole wheat make any difference? I mean, it's still carbs.
You still get a high carbohydrate content. That's very true. But the higher fiber content is going to help moderate how quickly that sugar gets into the bloodstream. Unfortunately, I see this with more patients than you might expect. Their favorite meal is pasta and tomato sauce, which they'll eat 3 to 4 times a week minimum at dinner because it's quick and it's easy and it seems like a reasonable choice. But tomatoes have a high sugar content and pasta is all carbohydrates. What's happening is that there are pastas out there that are labeled as low sugar or low carb content. And what they are is basically whole wheat pastas, labeled differently. That's a great first step, but eating spaghetti and sauce so frequently is still a huge problem. Once a week might be okay, but unfortunately too few doctors, and even fewer patients, bother to discuss limiting foods, even if they're labeled as diabetic-friendly.
Is there anything else we need to mention before we wrap it up?
I think we've done a pretty good job of covering the essentials of diabetes in this episode, but really we've only scratched the surface. The best thing you can do is pay attention to how you feel when you eat something. If you've got increased hunger and fatigue, if you've got increased urination, if you're frequently thirsty, maybe you have dry mouth or itchy skin, maybe vision changes, make sure to talk to your physician as well as making a note of what you've eaten lately. Check our website if you want more details. We'll have a few links that describe diabetes. The important lesson for today is basically this. Whether we're talking about type 1 or type 2 diabetes, or even prediabetes, there's always something you, as a patient, can do to help reduce the symptoms and your potential health risks. A type 1 diabetic isn't going to be able to generate insulin where none exists, but a controlled diet and a healthy lifestyle is still going to help. Don't expect an injection, a pill, or even an herbal medicine to do all the work for you.
That's all the time we have for today. These are short episodes that provide a brief overview of very complex topics. Everything we say is for entertainment and educational purposes only. Licensed healthcare professionals should advise you and be aware of changes you make to any aspect of your healthcare. Every person's needs are different. The links to references we've made about news articles, medical studies, or other materials can be found at level989.com/health, along with our contact information and the complete Don't Take Medical Advice from Podcasts disclaimer. Thanks for listening, and now go health yourself.